My name is Madeline Siegel, and I am going to be talking about my summer internship at Intown Animal Hospital this past summer. So a little bit about Intown. It is a small animal hospital located in the center of Midtown, Atlanta. The staff consists of one primary doctor who is also the owner of the clinic, as well as two other doctors who come in on occasion, but it's primarily the owner who works. The clinic is relatively small. We have 2 exam rooms. The smaller one is mostly used for cats just because it is so small. This picture right here is our larger exam room, which still does get a little cramped when we have a larger dog plus the client and doctor and a nurse in there. As well, we have an x-ray room, and we also have a prep area in the back. We have 1 surgery room, as well as 1 office in the back that all the doctors use. So Intown is a very small clinic, but the staff is very close, and they're pretty much a big group of friends, so it's great to work there and get to be a part of that family for a little while. Although it is so small, we have over 4,000 clients, so it is very large with the client list and is still growing. I had 3 main goals into going into my internship, the first being to experience the daily routine of a small animal veterinarian, both to get the feel for the responsibilities and the basic lifestyle one might have, although it does depend on the location and size of the clinic. The second goal would to be experience hands-on learning with the basics of animal care, so just to make sure that I'll be able to both handle the euthanasias and invasive surgeries, critical care patients, but also be able to react safely in a stressed environment. For example, we had one of our most aggressive dogs, Mookie, come in this summer for his annual, and we just had to be very careful. It was a very stressful situation to make sure that Mookie was safe, and both the staff and the doctors stayed safe, but Mookie got all of his vaccines needed, which we did effectively. And then the third goal I had was just to help determine whether small animal medicine is generally a good career fit for me, basically just taking all these observations into account. My daily tasks, I had a wide array of tasks. One primary responsibility I had was to handle appointments, so taking clients into an exam room and talking to them about what's been going on with their pet to make sure I can give the doctor a little bit of a background, as well as collecting samples, anything from blood work to an ear cytology if they're having an ear infection, a urine sample if they're having a UTI, anything like that. As well, then I would go to the back and pull up any vaccines they might need, and then go talk to the doctor a little about what's going on with the animal so that he knows, so he can do his exam and look for certain things. Then I would help restrain the animal while in the room while the doctor did a full exam and spoke with the client and received any other samples he might need. Besides appointments, doing basic, making sure that all of our drop-off patients have been seen and everyone is comfortable, sending out blood work and filling out paperwork, things like that. The dispense of medications and prescriptions, making sure all clients have the medications that they need for their pets. And then laundry, we go through lots of towels and mats and muzzles, things of that sort, as well as cleaning out the kennels and the clinic. So this picture I have here was one of the most exciting surgeries I saw this summer, although it was a little hard to watch, but this little cat had an infected growth on his leg and needed to be amputated, so I was monitoring the anesthesia for that procedure. Got to hold the leg afterwards.
It looks a lot bigger.
Yes, it was amputated at the hip, so it was yes, but he recovered very well and he's doing better now, so successful. My contribution to the clinic, I believe that my strong work ethic positively impacted the clinic in terms of making sure that all of our patients could be seen if they needed to be, so coming into work early or working through lunch, staying late, not being scared of double bookings, and just making sure that we can pack in as many patients that need to be seen. Communication skills was also a big part because I was new to the veterinary medicine field. So if I had any questions at all, I made sure not to hesitate to ask, to make sure that all of our pets have the correct care and medications, as well as asking lots of questions to make sure that I do know the procedures, so that if a similar situation were to occur, I would be more familiar with the procedure to be taken. As well, respect for both the clients, the doctor, my coworkers, as well as the patients. There are always those few clients who feel the need to argue, but it's just best to make sure that we can work through it without, making sure that everyone is satisfied in the end. And of course, my love for animals, making sure that all of our animals are comfortable as they can be in their situation, tending to them when they need to be, and things of that sort. So helpful courses, as I told you, I just switched into a wildlife major, and I am a second year, so last year I took general chemistry, which helped me a little bit with the basic understanding, as well as I took an animal practicum course, which we went out to a farm each week and dealt with horses, lambs, pigs, things like that, which gave me a basic understanding for animal care, although very different from small animals. However, future courses and more now, things like animal behavior, wildlife disease, and then the sciences, organic chemistry and biology I'm taking now, and biochemistry, ecology, things like that. So in conclusion, I feel that I did accomplish all 3 of my goals in my internship, and I greatly value my time spent at Intown. I met lots of amazing people, and I think that I'll definitely keep in contact with them throughout my life. You have any questions? Thank you.